You testified that some of the professionals involved in this case had to take their patient at her word. What did you mean by that?
So when you're providing therapy, you're in a very different role than an examiner. When you're the forensic examiner, you're just really looking at data to make a decision. When you're a therapist, you're an advocate for your client's well-being. And in fact, it's considered extremely unethical for a treating provider to ever provide opinion testimony like I'm providing, because it's so well known in our field that you're going to have an automatic bias for your client. It's almost a sense of protection, advocacy, wanting their best, which is why we also know that it's very inappropriate to convey any sort of opinion about whether a crime occurred, whether abuse occurred. We can certainly believe our clients. We can support them in their therapy and take them at their word. But when giving opinions and consultations, we have to be very, very cautious and really only provide the facts. We would state things in terms of, my client did report this, I saw this, here was our treatment plan, here was the diagnosis. It's, we're taught, we're trained to stay away from making any sort of opinions, understanding that most of the time, and most of Ms. Heard's providers were just treating Ms. Heard. They had never so much as done an initial interview with Mr. Depp and gotten his whole life story or his symptoms or his side of any of it. And they're going to be advocating, and the treatment relationship is about helping your client achieve well-being, not making formal psychological or psychiatric opinions.
So you're asked a question about a series of doctors. Dr. Cohen, treating physician?
Yes, he was a psychologist.
Yeah. Dr. Banks, treating physician?
Dr. Banks, yes, treating psychiatrist.
Dr. Anderson?
Yes, treating psychologist.
Every one of them had to take Amber Heard at his word, right?
Yes.
Excuse me. Oh, overruled on that.
Thank you. No further questions.